Good evening, everyone. I'm Dr. Vivian Asamoah. Welcome to another session of Gut Over It. It is Friday night, and so we're going to make this short and sweet. I'm Vivian Asamoah. I'm a gastroenterologist in Katy, Texas, and I have been doing these educational sessions every night in the month of February, and we have 2 nights left. So, yay! We are going to be segueing into March and opening up our Facebook group hopefully middle of next week or towards the end of next week, called Natural Gut Relief. But tonight I wanted to welcome everyone for joining me, and tonight I was going to be talking about 50 Shades of Red. 50 Shades of Red because this month has been a crazy shade of red. I've had a lot of patients with gastrointestinal bleeding on their own or post procedure. Well, not a lot post procedure, but more than usual. And I wanted to talk about different causes of bleeding because very often when people see rectal bleeding, um, they're concerned, they're very worried. So we're going to make this didactic, short, but something that you all can remember, and we are going to go from top to bottom. So you can bleed from any source in the GI tract, so from mouth all the way to anus. And very often the bleeding in the upper GI tract is very different to the bleeding in the lower GI tract. And the amount of blood that comes on and how fast the blood comes out also tells us how bad this problem is, right? Because it could be acute, where you're hemorrhaging blood out of your rectum, or it could be like small amounts, a little bit over time, like over years, right? So those are two very different things. But let's just start and work our way from top to bottom, right? So you could bleed because you've got ulcers in your food pipe, ulcers in your stomach, and or any kind of lesion like a mass in your stomach that's ulcerated and bleeding. And that would lead to you could actually vomit up what we call coffee grinds. And it really looks like coffee grinds because it's digested blood. So if you vomit up anything that looks like coffee grinds, think about that. Could I be bleeding? Is this a source of bleeding? Or you could vomit up fresh red blood. Now, this is an emergency. Actually, both are emergencies. If you're vomiting coffee grinds or you vomit fresh red blood, go straight to the emergency room. You could be bleeding from an ulcer, ulcers in the food pipe, ulcers in the stomach. But the bleeding that we're really concerned about when you just vomit of blood like that is you could have a tear in your esophagus called a Mallory-Weiss tear or a Boerhaave tear. Or you could have varices if you have liver problems, which is the vessels in the liver, in the esophagus, that just burst and bleed. And so that is fresh red blood. It is pints of blood. I mean, people come in with like buckets of blood bleeding, and that's an emergency. Straight to the ER, get an endoscopy right away, and try and identify and fix the source of bleeding, which we can. Now, if it's coffee grinds, it's most likely because you have ulcers in the stomach, irritation in the stomach, ulcers in the food pipe, and you vomit this coffee grinds. That's an upper GI bleeding. And it's dark in color because the acid in the stomach makes it dark. And also sometimes just the digestive juices digest the blood, convert the blood from fresh red to a dark color. Okay, so those are common causes of upper GI bleeding. Lower GI bleeding, so you could have just bright red blood coming out, large amount, large quantity. That could also be an ulcer in the colon, right? Lower colon that's bleeding, or you could have hemorrhoids that bleed. Don't be fooled. Now, hemorrhoids can sometimes give you that like a little bit of blood on the toilet paper, drip drip in the bowl. But hemorrhoids can also, if one of the hemorrhoids bust, it can give you a very significant, frank, bright red, red like this kind of blood bleeding, right? And that typically still is an emergency. A lot of people think hemorrhoids just bleed a little bit and shouldn't cause anemia, but we do see hemorrhoids that bleed chronically and bleed a lot, where men come in and say, I feel like I'm on my cycle, right? There's a lot of bleeding, and that typically requires, urgent attention, right? And then you also will see people who have diverticuli. Remember, we talked about diverticulosis, these little out pouches in the colon that sometimes can get inflamed, but sometimes, even without inflammation, they can just bleed. Because these little out pouches also have vessel linings in them, and these vessel linings can bust and bleed. And that kind of bleeding is called a painless bleeding. There's no pain, you're just hemorrhaging bright red blood, what we call hematochezia. Okay, if y'all can spell hematochezia, type it in. Type it in and let me know. Hematochezia, that's that bright red blood. So when you have bright red blood, lots of gobs, like maybe 200 cc's, 300 milliliters, and every time you go to the restroom, there's no stool, but there is blood, straight to the emergency room, because that kind of bleeding takes 48 hours to stop bleeding. It's often the doctor, we must, as a gastroenterologist, we must go in and do a colonoscopy and stop the bleeding, okay? And so that's diverticular bleed. Now, you can also have bleeding from just wiping a little hemorrhoid. Every time I wipe, it's bleeding. The problem with hemorrhoidal bleeding is when it goes on for a long time, you're never really sure whether it's just the hemorrhoids or whether you could have a polyp at the end that's bleeding, whether you could have anal rectal cancer that's bleeding, whether you could have an ulcer in the rectum that's bleeding. So whenever you see blood, and whenever you've seen blood for a long time, you have to see your gastroenterologist, because it's also possible you have a hemorrhoid bleeding and something else that's bleeding, right? You can have a hemorrhoid and a polyp or a malignancy and cancer that's bleeding. So one big take home from this message, guys, is if you see rectal bleeding, please consult your gastroenterologist. Please talk to your primary care provider and let them know what's going on, okay? Because it could be more significant. Little anal fissures can bleed. So you can get a little fissure in the anal rectal verge where every time you wipe, there's blood that comes out. So again, let someone at least examine so we understand what's going on. So we've talked about, and then when you have bleeding coming from the right side of the colon, like the other end of the colon, that blood is going to look a little bit darker, what we call the maroon colored blood, right? When you have blood coming from the small intestine, very often that's the kind of bleeding that's hard to identify. It is usually digested blood, which looks dark, sometimes black, like melena. So anything coming from the upper GI tracts where you're not vomiting it out, but it's actually coming from below, could be digested blood coming from the small bowel and the upper GI tract, like the esophagus and stomach, and that always will come out looking black. Perfect spelling of hematochezia. That always comes out looking black, dark, and is very foul smelling. And that is upper GI and small bowel bleeding. And you can bleed from the small bowel from things called AVMs, arteriovenous malformations. These are almost like those little red cherry spots that sometimes people have on their skins. You can have that in that small bowel. And if you take things like aspirin, Motrin, Aleve, Advil, that can trigger that bleed. And that bleed is very often hard to find. Very often we'll get patients who come in because their doctor has noticed their blood count is low, they're anemic. We've done an upper GI, haven't found anything. We did a colonoscopy, didn't find anything. Remember, there's about 15 to 24 feet of that small bowel that we can't get into. So when we do that capsule study, that little capsule with the video inside, you swallow it and it travels through the small bowel and you poop it out, and we can actually download the software and see what's going on in your small bowel. We can find ulcers in the small bowel, erosions in the small bowel, AVM, the cherry red spots in the small bowel masses, small bowel polyps that are bleeding, that we then have to go in and pick. So the GI tract is a highly vascularized tract. There are a lot of vessels here and there. All can bleed from the upper or GI, upper, mid, small bowel, or lower GI. So the description of your blood and the description of the bleeding, how often it's happening, the color, the smell, the consistency, as well as how much of it is coming out and how quickly it's coming out. Is it over 2 hours that it happened, or has this been going on for years? Provides a lot of information to your doctor. So just document everything, describe it as much detail as possible, because when you see your GI doctor, it may clue them into whether this is an upper GI, small bowel, or lower GI, like a colon problem. And again, use your phones, guys. Take a picture of that stool, because that's what really helps us get a sense of, do we do an upper endoscopy? Do we do a colonoscopy? Do we do both? And should we continue and do a pill camera study? And of course, getting to root cause is what we try and do at our practice. We try and really figure it out and get to the nitty gritty. Sometimes it takes us a while, but sometimes we see it right away. Most importantly, any bleeding after colonoscopy or after upper endoscopy, post-procedure complication, it can happen. Call your doctor right away, because that bleeding could lead to significant blood loss, low blood pressures. We don't want you to say, oh, I had a colonoscopy, so it's no big deal. Absolutely. After every colonoscopy, any significant bleeding, let your doctor know. You may need admission. May need a rescope so we can take care of it. All right. Again, my name is Dr. Vivian Asamoah. Thank you guys so much for spending the evening with me. I was trying to keep this short. I put on my African kente as a celebration of Black History Month ending February. Tonight, I'm honoring actually a new organization that I'm proud of. It is Black in Gastro. It is Black gastroenterologists in the United States of America. And we had actually our first association meeting this evening, and it was wonderful. So I think I'm going to get back on there and continue. It's a virtual party. But thank you guys for joining me, and we will talk tomorrow. The last 2 days, I'm going to talk about SIBO, small intestinal bacterial overgrowth, and SIFO, small intestinal fungal overgrowth, which are two areas that have become sort of a specialty for me as a functional gastroenterologist that I'm learning a ton about, and I'd love to share at least some ideas with and dig into it a lot more when we start our Natural Gut Relief Facebook group. Have a wonderful weekend, guys. And if you're listening to this live, thank you for joining me and supporting me. If you're listening to this on the replay, enjoy. Put in some likes, share some love, leave a comment. And I'm answering all questions this weekend. I'll have some time, so keep the questions coming. Have a wonderful Friday, guys. Good night. Bye.